Hi, this is Minister Joannides, and this is the Optimum Academy Diabetes 101, video number 2, types of diabetes. So let's get started. So what are the different types of diabetes? An estimated 26 million Americans have diabetes. 5% approximately have type 1 diabetes. So obviously a smaller number, much more worrisome type of diabetes, and this is due to a lack of pancreatic beta islet cells to produce and release insulin. So there's an absolute insulin deficiency. The body just doesn't make it. So that causes problems with glucose control in the body. Usually the onset of age is early in life, and these people are prone to ketosis, which is acidosis of the body. It becomes in an acid condition. And so ketoacidosis is a very worrisome situation that can occur and may require emergency room treatment or hospitalization. Obviously, these people continue to require insulin injections on a daily basis, maybe on an insulin pump, and they need close glucose monitoring. More common is type 2 diabetes, which is approximately 95% of diabetes cases, and this is due to insulin resistance. So the insulin that's produced is either not enough or not effective at controlling glucose levels within the body, and it may be a relative situation and could be progressive, that there's an insulin deficiency. It's just not being produced in large enough quantities by the pancreas, and so the person's blood sugar goes up. These patients are usually overweight, which can cause or to contribute to the insulin resistance, and they usually require oral medications or may also be on injectable medications, and some people actually require some insulin in addition to their oral medications in order to control their blood glucose level. So type 1 diabetes, with an absolute deficiency of insulin production, all insulin must be injected by needle or insulin pump. They usually wear a continuous glucose monitoring device, such as Dexcom, which is illustrated in the picture to the bottom right. And this is because a constant effort is required to balance what the level of glucose in the blood is and the calorie intake compared to how much insulin is going to be required for control. And this balance is delicate and can be affected by other illnesses. If the person has an infectious disease, they can elevate the blood sugar. They may be fasting for some reason, or they could be eating high glycemic foods, which cause a spike in glucose. And exercise typically lowers blood sugar levels. So the amount of exercise needs to be balanced with what the glucose level is so that low glucose levels do not occur, causing hypoglycemia. So the pancreas secretes insulin and glucagon to maintain a homeostasis so that the blood sugar level is normalized, hopefully. So in the pancreas, beta cells release insulin to help control elevated blood sugars, and if the blood sugar level is low, the alpha cells release glucagon to raise blood sugar levels, and hopefully this maintains homeostasis. But in type 1 diabetes, the person is at risk for ketoacidosis if the diabetes type 1 is uncontrolled. They're also at risk for hypoglycemia if they're overtreated with insulin or temporarily have one of those other conditions I mentioned previously. These people are at higher risk for long-term complications, cardiovascular, kidney, eye, or nerve disease. So the underwriting ratings are higher for type 1 diabetes than type 2. So the mortality risk of type 1 diabetes, it's a major mortality risk factor and often is highly rated for life insurance. The age of diagnosis, duration of the diabetes, the A1C control, and any additional risk factors are crucial to underwriting the overall risk. Any sequelae of diabetes and any of those organ systems that I mentioned may increase the mortality risk, causing a higher rating or decline. In type 2 diabetes, with an insulin resistance or relative lack of insulin, it also requires glucose monitoring of the blood sugar, and hopefully the A1C is controlled. And in addition to treatment with medications, dietary restrictions, low glycemic food, so there's not glucose spikes, and portion control is helpful. Appropriate exercise to try to maintain ideal body weight, and then whatever oral or injectable medications may also be required. In type 2 diabetes, applicants for life insurance may not be aware that their A1C is elevated until they have blood testing for life insurance. And if a new diagnosis is made during underwriting, if the A1C is very high, it may be prudent to wait until the applicant has been evaluated by a physician or healthcare professional. Unless the A1C is just slightly or modestly elevated, we may be able to take the applicant with some sort of rating. Gestational diabetes. During pregnancy, the glucose level in the mother must be tightly controlled for the health of the fetus. In order to determine whether a person who's pregnant has gestational diabetes, a glucose tolerance test may be performed. And at the bottom right, that orange drink is a load of 75 grams of glucose. So that is ingested, and then the blood glucose levels are monitored over the next several hours. As you can see on the graph to the bottom left, the green graph shows what happens if the person's blood sugars are normal over the time period, over the next 3 hours after injection of the material. However, the red line shows what happens if someone has gestational diabetes. The red line shows elevated blood sugars at all the testing times, fasting 1 hour, 2 hours, and 3 hours. So that person would have gestational diabetes. So that person would need to have insulin to control the blood sugar levels through the pregnancy so that the baby, the fetus, is not exposed to elevated blood sugar levels, which can cause problems. Women who have gestational diabetes, the blood sugar may return to normal after the baby is delivered, and they may go on in life with no further problems, or they may be at risk, some elevated risk, for having diabetes in the future. So in gestational diabetes, that high blood glucose level in the mother brings extra glucose to the baby. The baby can put on extra weight, so large babies can be delivered in women that have gestational diabetes, which can be a risk for the fetus. So that completes this episode of our Diabetes 101 series.